We know that eating well and exercise are important for our health, but what about where we live, whether we can afford to go to the doctor or buy fresh fruit and veggies? Is it true that some of us start our lives and spend a lot of our lives behind the eight ball? Associate Professor Claire Littleton is the Deputy Director of the Centre for Healthy Sustainable Development at Torrens University, Australia. She's been looking at how important these so-called social determinants are in improving our health. Claire, thanks so much for coming on today.
Thanks, Paul. I'm really pleased to be here.
And we do here, we talk about the socio-economically challenged all the time. What are some of the things that impact on our lifetime of health?
Oh, look, a child's life is really important, and a child's life turning into a youth, into an adult, is really important. And often we focus, like you said, on these behavioural issues, and we have a really good acute care system. If children get sick, many children can be treated. But what we want to focus on more is this idea that if we can put a sort of scaffolding, a social scaffolding around a child and their family to deal with, the sorts of things that we know keep us healthy, things like, parental income, housing, making sure that there's social connections, being able to access fruit and vegetables, affordable fruit and vegetables, and quality fruit and vegetables in any suburb in Australia. That should be something that we're really focusing on.
Claire, this is all the more important, of course, because, if you have some understanding of how our health dollars are used, we know that so much is used in an emergency setting, isn't it? We only really care about health if someone turns up at the hospital, at the casualty department in an ambulance.
Yeah, that's right, and that's becoming overloaded. So, if we take a step back and we start to put prevention measures, we look at the social factors that would prevent some people entering that system. If you look at access to healthcare services outside that emergency system, they're becoming, harder to access, less affordable, and in many ways, not appropriate for many of our population groups from a cultural perspective as well.
And it generates so many false economies, I'm gathering from your research as well, because, issues like, criticisms over our social safety net, for example, whether we're getting good bang for our bucks there.
Yeah, absolutely. We know that if parents have income that can support them to support their children, we can't expect parents who don't have an income to be able to do all the things that, as children, it is meaningful. And, sorts of things like literacy, buying books, making sure that children have a safe and safe place to live and to grow and to learn. And in Australia, we do put a lot of emphasis on green spaces, and that's great, and that's really good, but it's not the only measure that we need to address. There's some deeper measures that we need to start to address, and I think the pandemic has shown us that in many ways.
Claire, you've actually looked at some of our health policies. Can you tell us what you discovered?
Yeah, we actually discovered that really, if you look at it from a social determinant perspective, which is kind of the technical word for social factors, that only 10% of the action in a policy, so the strategies at the end where the government commits to some action, are addressing the social determinants of health, which is pretty disturbing when we're talking about children. I think most people can understand that we need to have a more balanced system. We need to be, of course, if children get sick, we want them to be, we want a cure, we want medicine, those sorts of things, but we don't want them to be there in the first place. And most children shouldn't be entering the emergency system, more than once, hopefully, under 5. But many of our population group, in our more vulnerable groups, are entering hospitals at an emergency setting much more than that.
So what needs to happen from here on in then?
So I think, we have policymakers who understand this evidence. This evidence of the social determinants of health has been coming out of the World Health Organization for years. Many Australian researchers understand this, and therefore, we've trained our policymakers in things like Masters of Public Health, which means they understand this evidence. But, other research that I've done in recent years where I've talked to policymakers shows there's a lot of barriers. So there's a lot of problems within the system of health departments being very siloed in what they can offer and what they can address. So it was really good in our research to see that education departments and health departments are really starting to talk about what children need, and especially around the area of mental health, which has certainly come up in this set of policies as being an important issue, which is fantastic. But, there's other departments we need to work with as well, things like transport, social services, all those sorts of things need to work together. So the next bit of research is to again, go and talk to policymakers and find out what the barriers are right now, and how we can help them to be able to navigate those systems that they have to work in to write policy to make sure that we're doing the best we can for children and for youth and for families in Australia.
Yeah, that transition's interesting, isn't it, Claire? Because there's this general presumption rather, when we try to make people accountable for the circumstance in life that they find themselves in, that they turn 18 and they're expected to flick some sort of magical switch that says they now make good decisions. How imposing and limiting is the childhood of someone in regard to these kinds of predeterminants and health outcomes?
Childhood is incredibly important. Again, the World Health Organization has talked about early childhood development as being a major factor which can influence a child across their life trajectory, their life course into adulthood. And, governments want people to be able to cope when they turn 18, but much of our policy until now, this policy shows there's a bit more of an extension into middle youth and early adulthood. But we really do drop children at about 8 in policy very often. There's been a lot of work to fix that, but we need to do more. We need to do more for this transition, and especially if children have experienced been in a vulnerable situation in childhood, going to adult is not easy when that happens. So we need to make sure that we have scaffolding around that group as well in particular, so that they can be happy, healthy, productive adults as we would all wish for them.